Hello and welcome to Health Live at Seniors Today. We have here with us Dr. Anand Shroff. Yet again, he was here with us in July 18, 2020, and but indeed by popular demand. The questions that were there for him were so many that we requested him to come here again and specifically address questions on glaucoma, diabetic retinopathy, and age-related macular degeneration. A little about Dr. Shroff. He is a leading eye specialist and surgeon with specialization in ReLEx Smile, LASIK, Bladeless EpiLasik, C3R, Glaucoma and Corneal disorders, cataract, including accommodative and toric implants. An experienced anterior segment and refractive surgeon and a reputed educator and researcher, he has trained several ophthalmologists from across the world during LASIK workshops in India and Europe. Dr. Shroff is one of the most experienced refractive surgeons, having over 17 years of experience as a LASIK and cataract surgeon. He has performed over 20,000 cataract surgeries and 20,000 LASIK procedures and continuing. Also a glaucoma specialist, he runs the Glaucoma Clinic at Shroff Eye, performing various laser treatments and filtering surgeries with implants. He is a former consulting surgeon of the Bombay Hospital, and he currently works at Shroff Eye Hospital in Bandra and the Shroff Eye Clinic on Marine Drive, both in Mumbai. Welcome to Health Live at Seniors Today, yet again, and thank you for being here.
Thank you. It's good to be back.
Just before we started, I was speaking to you about how it has been since July. So, your initial words on the pandemic, and do you think people have kind of gotten used to the ways to protect themselves?
I think now after about 7-8 months of the pandemic, I think people are now slowly getting used to a different way of life now. And we've been noticing that, well, there is a little bit of fear and some have extreme fear, but there's a lot of people now who have become much more, I'd say, easygoing about it and taking the due precautions that they need to. And now they've started moving out, which is good. And in fact, we see a lot of elders now coming over. And of course, we take our due care that we need to. But we've been seeing a lot of people taking the efforts to now come out and do all their various activities. And that's a very good sign, actually, because we need to start moving along. We can't just wait like this.
Absolutely. And you, Doc, for your initial words, and then we'll have questions coming in. A lot of questions have already come in via mail, and I see 70 odd people over here. And please post your questions in the Q&A tab, and we will address it to Dr. Shroff. Over to you. Over to you, Dr. Shroff.
Yeah, okay. So just one sec, sorry. Yeah, so how shall we start this whole thing? Do you want me to start with like a Q&A, or do you want me to talk about some of these things?
A few words about each of these things, and especially for given that most of our readers and the people who are here are senior citizens.
Well, the important thing about a certain point in life, one has to be a bit careful about things like glaucoma, more so because what happens is that glaucoma is something that is, number one, it's very silent. Number two, it's irreversible and it's hereditary. So you've got to be very careful to make sure that you have regular checkups, particularly if you have a history of glaucoma. One thing I tell all my patients, and which unfortunately comes all the time on WhatsApp, is drinking lots of water in the morning. And that's something I, unfortunately, thanks to WhatsApp, have to tell all my patients repeatedly, please don't drink too much water at one time. That typical thing about drink 4 glasses of warm water in the morning and all that raises the pressure in the eyes. Glaucoma is when your pressure goes up in the eyes. The usual range is 10 to 20. It can be adjusted for some people. So it can be, in some people, it may be 15 to 25. Some it may be 8 to 18. But typically, it's about 10 to 20. It is it is adjusted per case. Having said that, going back to my point about drinking a lot of water, we used to, in the old days, before all these fancy things came, we used to have all these fancy tests came and things. We used to have only one way of knowing whether a person had glaucoma or not, and that was what was called the water drinking test. And we'd make people drink 1 liter of water early in the morning and then check whether the pressure went up or not. And we would find that, and we would in fact find that those who had glaucoma would have a serious spike in their in the pressure levels, and those who didn't would have a slight rise. So particularly those who have a history of glaucoma in the family, please don't drink too much water at one time, particularly not in the morning, that straight one odd liter of water at one time. Try to restrict to 200 to 250 ml maximum per hour, and that should include everything. That's your tea, coffee, juice, milk, water, lassi, whatever you have. Everything has to be counted, the whole, you have to count everything in 200 to 250 ml per hour. Through the day you can keep on having, but not at one go. Another thing I want to emphasize about glaucoma is that it's very important to come annually, because as I said, it is completely irreversible. So whatever loss happens because of glaucoma cannot come back. And what unfortunately happens is that glaucoma affects what's called the optic nerve of the eye. The optic nerve is what links the eye to the brain. And we don't see with the eyes, we see with the brain. So what happens is that if that optic nerve gets affected, it is part of the brain and it links 1 million points in the eye to 1 million points in the brain. And the more that nerve gets damaged from high pressure, you end up with having vision loss. And typically the first parts of that nerve to get affected are the ones that supply your side vision. So you end up with poor vision on the sides. One typical mistake that people make is to have their checkup done only with the optician store. Now what happens with an optician store is that they only check the central vision and they don't check the pressure, they don't check your optic nerve. So what happens is that you end up, and what happens in glaucoma is that your central vision is the last to go. So what happens here because of that is that you go to the optician, get checked up, and your central vision is fine. And the optician tells you, yeah, you can see everything is nice, etc. So you get this false sense of security thinking that everything is fine. And because of that, one ends up going to the optician often enough, thinking everything's fine and not meeting the eye doctor. And you end up with a severe vision loss before you actually land up with the doctor. And once you have a severe vision loss, it's often very difficult to also treat. So that's the other thing I want to talk about glaucoma. I just wanted to ask you that that should we start one topic at a time and answer those questions, or do you want me to go through everything and then?
Could go one at a time, and
sorry.
Yeah, we could go one at a time. We could start with glaucoma and then look at other things.
Yeah. So I mean, I'd like to answer if anyone wants to ask anything. Otherwise, I could just go on with.
So we have a question from Milan Mehta, who says, "What is the symptom one gets when he or she gets glaucoma?"
So basically, there are two types. Okay, glaucoma is either open angle or it's narrow angle. So if you have an open angle, then it's usually coming from your hereditary part of it. And even though you have the angle of the eye is where your fluids of the eye leave the eye. Now all the structures in the line of sight have no supply of blood. So you have fluids that move in the eye. They come in from one point and they go out through what is called the angle of the eye. Now from the angle, if you have an open angle, at that angle there is a meshwork. So it's like kind of like a meshwork through which that fluid goes out. And because of hereditary reasons, that meshwork fails to take out the fluid in time. Now what happens because of that is you have a normal inflow and your outflow is poor. So you have a slight rise in intraocular pressure. So it goes over the 20 mark, it goes to 25, 27, 30. And such cases have no symptoms at all. You may get a slight, maybe like a heaviness in the eye. Some people claim they get a slight heaviness in the eye. Some people just feel, often what happens is you have a change of number. So if you have a constant change of number, it's important to go to the doctor. It could be cataract, it could be glaucoma, it could be anything. So one has to just, if you have a quick changing path, then please show up with the doctor. The other type is what's called a closed angle. Closed angle is where you get a glaucoma attack. So the pressure shoots up to 40, 50, 60, and then you get blurring of sight, you get pain in the eye, some people like a vomit, the eye, your sight drops, eyes turn red. So you obviously know that there's something wrong. So that's actually a safer thing to have than to have that closed angle type. I mean, the open angle type, because the open angle type has no symptoms only. So you often lose a lot of vision before you actually go to a doctor. And the narrow angle one, which leads to an attack, is the one where at least you know your eyes are red and you rush to a doctor. You obviously have other symptoms also, like you have decrease in vision, you get pain, some people vomit. So that's, I would say it's a more safer thing to have, because you can immediately treat it and you're back to normal.
Thanks. We have a question from Pankaj Mehta, who says, Doctor, I'm having glaucoma on the right eye, and the cataract is removed just before 8 to 9 years for the right eye only. I'm putting iotim drops 5% twice a day and regularly checking eye pressure for both eyes, which comes 14 to 15 in the left eye and 17 in the right eye. Please guide for any care to be taken. That's Pankaj Mehta.
Well, the important thing is that once you have glaucoma, you anyway have to meet your doctor every second, third month to just check and see that the pressure is normal, number one. So just because you're putting drops doesn't mean that you're normal and you stay home, because often you don't know that it's gone up or whether the efficacy of the drops is lowered or something over time. So you have to keep having checkups done. Iotim is a good drop. It's in fact one of the oldest ones in the market. Timolol is the name of the drug, and that's been around for really long. It has the least side effects of any kind. Of course, if you've got shortness of breath or you have any heart issues, then you should think about changing. But if you're just normal otherwise, then it's fine. The important thing here is that you have to be told how to put your drops in the eye. That is the single most important thing, which nobody knows how to put in their drops, and that's the sad part. So when you put drops in, number one is when you put drops in your eyes, after you put the drop, you have to shut once only. If after drops, if you start blinking, then what happens is the drop goes down into your throat, and then eye drops cause an ENT problem. So if the drops keep going down, then you end up with a sore throat, and sometimes the throat is linked with the sinuses, and you end up with a pain in the head and in the sinuses and stuff. So that is one thing that you have to keep in mind, that you have to lie down and put your drops. You have to wash your hands first, then you have to put the drop in, and then close your eyes once only. If you blink, it goes down. If you squeeze, it comes out from here. So you got to shut once, and then you have to take your you have to wash your hands before putting drops. So these two washed fingers go straight over here, and you block the opening, or what is called the punctum. You have to block the punctum from where your drops would normally go in for about 60, 80, 90 seconds. So once you block it that way, then the extra will go out from here, but it won't go down into your throat. And typically only 15% of drops go into your eye. The rest of it will not. So if you don't put your drops in the right way and you start blinking and you sit and put them and you start walking off, only 1 or 2% of drops goes into your eye. So the efficacy is much, much lower.
That's quite interesting. From whatever you tell me, to ensure that you follow the procedure that you suggested, it's not going to be very easy for people, and especially for people who are seniors who may not necessarily be able to take care of themselves as well.
Well, see, the thing is that this is something that you can't help, because this is how your tears normally go out of the eye. When you blink, there's a pump over here which actually sucks out the tears and sends it down into the nose. So if you blink, then your drops will go out until some new way of maybe putting in a gel or some inserts come in or something. Till then, one has to put the drops in the right way, because don't put the drops in the right way, you'll end up with more drops. And then more the drops, then you'll even what happens is then you start taking even more shortcuts in trying to put the drops in. So it's all a vicious cycle.
We have a question from Basant Khatwani, who asks, is degeneration of the body the only cause of glaucoma?
There's no link with the body actually. It's just that the angle of the eye has its own separate, it's linked a lot with your hereditary factors. So if you have a hereditary factor that would make cells function less at an earlier age in that angle of the eye, then what happens is that your fluids don't go out. So there's nothing to do with, I mean, it has got nothing to do with how your general health is or whatever. So there are people who are in very poor health and yet don't have it, and they're absolutely fit and fine, but they have a family history, so they have to look after this, and the pressure's up. So there's no link with health of the body.
We have a question from Ravi Bhagat, who
Yeah.
said, my mother, who's 81, had cataract surgery some 18 years back. She has multifocal lens. A few years later, she was diagnosed with glaucoma, takes Betagen eye drops. These drops have been discontinued by the manufacturer. The last stock I have will expire at the end of the month. Please suggest an alternative, as it's not possible to take her to any doctor today due to
I
current.
mean, there are so many in the market, but if she's on Betagan, then I mean, if she's not got a sulfur drug allergy, then she could put something called dorzolamide, which goes by the typical trade name of Dorzox. So that's safe. If you don't have a sulfur drug allergy, it's absolutely fine.
Right. We have a question from Ashok Kumar Grover, who asks, is ARMD hereditary? At what age it usually starts? Are there any preventive measures to delay its onset?
Well, two, three things about macular degeneration is that number one is that, the thing is that we see it a lot now because we live a lot longer. Until independence, Indians lived up to 37 years of age. And then after the war, we had like all these antibiotics come in, and a lot more came in, of course. So now we live double of that. But the eyes were always made for all this. So we find a lot of people now who are in their 70s, 80s, and hitting their 90s who, in fact, have issues with the macula because it was never meant to last so long. And so what happens is macular degeneration can be a hereditary thing also, and it can just be there because you just live long enough. So I would say one important thing is to protect the eyes from UV light. So whenever you're going out, you must always have glares on, so you save yourself from ultraviolet light, which is there in your typical sunlight. And the second thing is have like a balanced diet with a lot of leafy, vegetables, fruits, all your salads and things. That helps. Unless you want to take supplements, of course. Vitamin supplements are there, and we do have a lot of these vitamin supplements that are supposed to help for macular degeneration. There are no studies that actually tell you that's a short way of fixing ARMD, but yes, it helps.
Milan Mehta asks another question: are there any food or drinking habits that one must maintain to avoid glaucoma or macular degeneration?
Okay, so glaucoma is purely to do with the volume that you have. So anything less than 200 ml per hour, totally with everything, as I said, your tea, coffee, juice, drinks, your milk, whatever, I mean, everything. Water, of course, everything has to fit into 200 to 250 ml per hour. Anything more, and I mean, will slowly make your pressure go up. If you drink 1 liter of water at one go, your pressure goes up by 8 points if you're normal. And if you're not, then you can go up by 10, 15, 20, anything, if you have a history or if you actually have glaucoma. So that is one thing which is important with your food and drinking habits. The thing with the macula is that it's the center of the retina, and that's to do with your central sight. So the important thing to do, the important thing I would talk about with the macula is you got to control smoking and drinking, because those two things can cause a toxicity of the retina. So within limit is fine, but anything excessive can cause issue with the macula.
We have a question which says, Doctor, how do I check my eye pressure? Can I do it at home?
There were ways and means of doing it, but they weren't very successful. There was something that would do it from top of the eyelid, but it was not very accurate. I would recommend that one should check it with a doctor every third, fourth month. Just check if you have glaucoma. If not, once a year checks are good. If you have a family history, then you should definitely check it once a year, because it's something that's totally silent. So you better safe than sorry.
We have a lot of questions which are, not just on glaucoma, but other things as well. So would you like to talk about diabetic retinopathy?
Yeah, I think I'll talk on that. It's an important topic. So we'll go to that first. So basically, diabetes is something that affects the eye, it affects the kidneys, affects the brain and the nerves of the hands and legs, particularly these four. Now, what the thing here is that the whole trick about diabetes is to look after it and maintain it. That's a very important, because if diabetic level, if your sugar levels are high, then there are issues all over the body. Any check that involves diabetes always involves an eye checkup, because the retina of the eye is one place where you can see all your arteries and veins straight up. You can actually see the arteries and veins inside there. That's the only place that you can see your arteries and veins. And diabetes, if not controlled well, leads to bleeding in the capillaries. Now, because of that, this is the only place where you can see it. So if anything is happening in the eye, if you have a bleed in the retina, then you also have it in other parts of the body. So that's why any diabetologist will always tell you to have an eye checkup done every year, so that he knows he's on track and everything's fine. Now, what happens when diabetes affects the eye? So the first thing that happens is, because of sugar, this number one affects the wall of the capillaries. So the capillaries get weak, and some walls get so weak that you have an outpouching happens. It's what we call a microaneurysm. And those over time can sometimes bleed. The other thing that happens is that you get what's called ischemia in the retina, which means that the oxygen supply is poor. Now, when your sugar is not controlled well, the hemoglobin in the blood is not able to pick up oxygen. Now, when it can't pick up oxygen, some parts of the retina don't have enough of oxygen supply, and they go into what is called ischemia. Now the human body is made in a way that's always trying to help. So when some parts of the retina don't have enough oxygen, you have a factor. It's called angiogenic factor. That factor is secreted out from the arteries which are close to your area of ischemia or low oxygen supply. Now so what happens with this angiogenic factor is that it leads to new blood vessel formation, in the hope that these new vessels can go into the area with less oxygen and supply oxygen over there. But these new vessels are only one cell layer thick. So often these bleed. So typically what happens in diabetic retinopathy is that you get bleeding in the retina, and this happens because the oxygen supply is low. So then we have 2-3 ways of fixing that. One is that you can either decrease the oxygen supply in the retina by actually shutting down areas which have less oxygen. So with a laser, we then shut off areas which have less oxygen, so that the oxygen demand and supply is maintained, and you don't have any new blood vessels which form, and it will not bleed again. Second issue with this is that we also have to, besides the fact about the bleed, is that it can generally also cause what's called a vitreous hemorrhage. So the vitreous is the jelly that fills the whole eye. Now this jelly that fills the whole eye, sometimes these bleeds go straight into the vitreous, and then you have a sudden loss of sight, which also can happen. So that, of course, then you know that you've lost sight and you go immediately to the doctor. Now, so this ischemia and everything else, all these things can be stopped by controlling your blood sugar. Now, so this one test called HbA1c or glycosylated hemoglobin is a very good marker for knowing whether your blood sugar has been controlled well over time or not, because this gives you the average of 90 days of your sugar level. So you get an average of 90 days, not that every day, okay, today it's 100, tomorrow 150, next day it's 200. So you're not sure whether you're maintained or not. Here it's like a one day match, you know the whole score. It's not like fifth over, fourth ball was a sixer, and then the next over, third ball was a wicket. So you have no clue what exactly happened in the match. Here what happens is you get the entire 90 overs, you know exactly what happened over 90 days. You have the average score. So important in diabetes is to maintain the sugar. That's the single most important thing. You have to watch your diet, you have to exercise, but more important than exercise even is watching the diet. Just the other thing that one needs to know, that when sugar levels are high, cataracts can also happen a bit earlier. So in diabetics, if they're not very well looked after, then you could have a cataract happening fairly early. So that's the other thing to look out for. And if you're completely out of control, then sometimes retinal bleeds can also cause a very difficult form of glaucoma. So that's the other thing. It's very, very important to control sugar, because these very difficult types of glaucoma often can also lead to loss of vision.
So we have a question from an anonymous attendee who says, my father is 93. He was asked for a cataract operation, but he did not go for the same. But 2 years back, he agreed and we took him for the same. But on the day of the operation, his eyes became red when he was advised to put drops in come. Then the doctor did not operate him as he said it's not right, so he did not get operated. He has eyesight issues now, therefore, now I think it's risky for the operation. Therefore, what is the best way I can keep his eyes okay and at least he can have reasonable vision?
Well, problem with a cataract is that it never stops, you know. So you just keep on getting more and more mature. Now at 93, I mean, I don't know what exactly happened and what stage he went for his cataract surgery the first time anyway. But unfortunately, we don't, I mean, it's hard to say unless one sees the case to know whether it yet can be done or not. Now, of course, cataract surgery is very simple nowadays, you know, it's just without any injection stitch, nothing, just with eye drop anesthesia, we chat and have a good time, it's over. But I don't know at what stage he's reached now. If he's become a dense, hard black cataract, it may be difficult to treat at this point. So very hard to say what it is and what are the morbidities he's got, whether he's got diabetes, hypertension, other things which go along with this, any heart trouble. So one has to take a whole, kind of a overall view on this, talk even to the anesthetist and see whether it's safe to do or not to do. So that, of course, one has to, that every doctor takes his own call on this. So very hard to say whether it can be done now or not. But yes, if it's not done, it'll just make the vision worse.
We have a question from Katie Badanji, who says, Doctor, my husband is aged 75 years and has just started getting a cataract. Is it okay to wait for some months before it gets removed?
There's no need to wait for a cataract if it is affecting the sight in any way. I mean, people who do night driving and all have to go earlier to have it done. And those who are mainly homebound can wait a little longer. But nowadays we don't wait till the cataract gets ripe and all that. That's all old school. And we have stopped and moved over to the new technology nearly maybe about 25 years ago. So now we don't wait unless there's a reason to wait. And of course, now with COVID, if there's fear or something, it's fine. But now we've been doing a lot of them and absolutely safely. So there's frankly no reason to wait unless there's a serious health issue otherwise.
We have a question from Sushil Kumar again around cataract. I have cataract as well as there's corneal damage. Is there a safe way to have the operation keeping the cornea safe? He is 73 years old.
Well, corneal damage is a very generalized term. We don't know, but typically people have this hereditary thing called Fuchs dystrophy. So that's when the corneal cells are fewer, they're slightly weaker and all that. So then it depends on the type of cataract. If you've got a hard cataract and you've got a weak cornea, then sometimes it could end up in even having a corneal transplant done only of that last layer. And if it's regular cataract, then we now have liquids that we put in the eye that actually form a thick liquid shield between the cornea and the lens, and then we can take out that lens, which is hazy and called a cataract. So we can take out the cataract, we can remove the lens very safely because it's a fat liquid shield, and then once we finish the surgery, then we take out that liquid and you're back to normal. So it would really depend case to case, but sometimes it's a weaker cornea and a very hard cataract, then there is a risk. So then we have to sometimes do both the procedures. We have to remove the cataract, also put a lens, but we also have to then probably repair the cornea.
I have a request to people who are posting questions. Please mention your age when you're posting questions. It will just make things easier for the doctor to respond. So we have a question from an anonymous attendee again, who says, my father, aged 76 years, has dry macular degeneration in the right eye from the last 10 years. This year, he has been diagnosed with wet macular degeneration in his left eye. In this eye, he has been told to take injections for a minimum of 3 months. How effective are injections for wet macular degeneration?
For wet ARMD, I think there's no choice. One has to take those injections because otherwise it'll get really bad, and your entire, I mean, you could lose sight very, very rapidly. So of course it depends from case to case, but yes, now that we have these injections, we've been able to save a lot of people from losing eyesight. But dry is okay. I mean, dry has to just be watched. There's this chart that we have with lines, which is known as the Amsler's chart, and that Amsler's grid. If you we ask people with dry ARMD to check it every week, every month, and if any of the lines are curvy or not absolutely straight, then they have to go to the doctor, because then dry has probably turned into wet, and wet is the one which is a bit dangerous and can cause serious loss of sight. So wet is not to be taken very easily and very lightly. One needs to go immediately to a doctor and get it fixed. And if he said that need injections, then you need them. Sometimes you need 3, sometimes may need more also. It would depend on case to case.
We have a question from Mr. C.A. Shah, who's just responded that his age is 62. He says, my sister almost lost her vision in one eye due to glucosamine. What precautions do I need to take and how frequently do I need to get my eyes tested?
Well, there's no, I mean, glucosamine didn't make sense to me, but basically if you've got diabetes, you've got to check your eye at least every year if you're under good control. If not, then probably every 6 months. And if you have something, if you have a diabetic retinopathy issue, then maybe every 3rd to 6th month, depending on even the site and depending on what the doctor has told you.
We have an anonymous attendee who's asking a question for his 77-year-old mother. Do you suggest any exercise for molecular destruction of the retina?
Molecular destruction. It didn't make sense to me. Again, we don't use that term around normally, but because the retina normally doesn't get destroyed, it is the macula, which is the center of the retina, which usually has an issue and which has this aging change, not the rest of the retina. So macular degeneration, you have to take care. As I told you, you have to be careful. I mean, you want to take vitamin supplements, that's fine. You can take leafy foods and salads and things and whatever raw foods, those are helpful.
By the way, Mr. C.A. Shah has just sent a message saying that he referred to glaucoma and not glucosamine. So that was a typo.
Oh, thank God. It didn't make sense to me. I was just wondering what he was saying.
Wondering what? I haven't heard this despite being...
It didn't make sense to me. So I said, anyway, we'll circumvent that part and move ahead.
Yeah, okay.
So now, what was the thing again? If you can say it with the right...
Yeah, so I'll just go back to the question. It is, my sister, he is 62 years old. My sister almost lost her vision in one eye due to glaucoma.
Glaucoma.
Precautions do I need to take and how frequently do I need to get that?
No, I think he needs to meet a doctor once a year and watch his liquids, not to drink too much at one time.
Right. We have a question. Mr. Mr. Milan Mehta, I'm not going to ask your question. You've already answered a few. This is by an anonymous attendee who says, I see floaters after cataract surgery. What are the implications?
Well, see, the thing is that floaters come from the back half of the eye. So behind the lens and in front of the retina, you have this whole expanse of the eye that is filled with a jelly called the vitreous. Now that vitreous is a liquid gel. Now normally it stays quite hard and tough, but it's made of fluid and it's made of fibers. Now typically, like for example, even a young kid with a high number, nature changes your number by making your eyeball longer. So the jelly in the eye in these youngsters who have a high number tends to be quite liquid. When you have a liquid jelly, then those fibers start moving around. The moment they start moving around, you can see them. Particularly if you have a very white wall, or if you're looking at the computer screen, or if you're looking in the sky, you will find that you see these hair and worms moving around. So that is what we call a vitreous floater. So the fibers that you see are typically what are called vitreous floaters. So those floaters, number one, happen with age. They can happen if you have a high power, and sometimes you had a bad jerk to the head, or you had a long journey or something, and if that jelly got shaken up a lot, then also it can happen that you suddenly start seeing floaters. Or if you've suddenly painted a room very white or something, then it can happen that even normal fibers in the eye can be seen outside. They look like floating objects or hair, worms. Some people see it like a mosquito up, and if it's lower down, you see it like ants. So those are normal fibers of the jelly of the eye. So if you see a lot all of a sudden, then it could be that there could be an issue with the retina. You could have had a slight tear or an issue with the retina. So you have to immediately then go to like a retinal doctor. If you see a sudden large number of these floaters in the eye, but those usual typical hair and worm type of things are absolutely fine.
And there's a similar question from Shanti Narayan, who's 69. She says, she says, or he says, sorry, he's 69 years old, underwent cataract surgery 2 years back. Now I see floaters. What are the...
So what happens is now with cataract surgery is that you're removing the human lens from a very thin bag. And then once that lens comes out, then the new lens goes in that same bag. Your human lens is like a mango, it has skin, pulp, and seed. So we take out the pulp and seed and we leave the skin. And through a small opening in the skin, we then put a new lens in the eye. Once you put that new lens in the eye, then the skin and the lens both fuse together. Now what happens is when you're working, what happens when you're taking out a lens from the eye, you have fluids going in because you have to replace that volume which you took out, because if you just take out a lens and then the eye will get flat. So as the lens starts coming out, you have a liquid that goes in and forms the eye. It keeps it well formed. Now when that fluid is moving in that bag, what happens that some waves can happen because it's a very thin, it's a 4-micron bag. And so what happens is that you have thin waves which come in that bag, and sometimes that can make the vitreous shake a bit also. So a little bit of shaking on the vitreous and you're more prone to having floaters. You could, after cataract surgery, have floaters. The other thing is you could already be having pre-existing floaters, and because of the waviness of that bag while you're doing the surgery, sometimes those floaters which are lying on the side, which you don't see normally, which are lying at the periphery, sometimes those come in the middle and you can see them. So it could be anything. It's very hard to say what is the reason why the floaters came.
Okay, we have 100 odd attendees, and I can see that we have 21 questions waiting to be answered, plus several more. So I want to ask you this question, which has been, there are two of them, which is CNVM curable, or do we just keep on getting costly injections in eye to maintain a status quo?
Well, some kinds can be fixed, and some just need more and more injections to be handled. That CNVM is this wet ARMD, which in some cases needs more. I'm not the perfect authority to answer, and it would vary from case to case because I don't do a lot of retinal work myself. But having said that, the thing is that in some cases you do need to have injections after a small gap again, because some types of CNVM form a very thick membrane otherwise, and then becomes difficult to treat at a later date, and you might need to go for a surgery later, and which might not be very successful also. So what can be fixed with injections seems to be the safest and the fastest way to do it.
We have a question from Sushil Kumar, who's 73 years old. He says, I had LASIK done, so the pressure in the eye does not go up. Is glaucoma treatment only to keep the pressure down, or is there a treatment for the loss of vision? I'm using Repatek drops. This is Sushil Kumar, who's 73 years old.
Okay, so basically what happens with LASIK is that with LASIK what happens is that there is a basic drop in pressure because we have made the cornea slightly thinner. So I don't know if I told you in the beginning that 10 to 20 is usual pressure, but based on the thickness of the cornea, we have to compensate in every case. So in some people 8 to 18 may be normal, some people 10 to 20, some people 15 to 25 may be normal. So when you do LASIK, typically your range goes down. So if you're 10 to 20 before LASIK, after LASIK you could be 7 to 17. So it's not that not that you can never have glaucoma, but you have to adjust for your corneal thickness. So once that is adjusted, then you know your range for the future then. So once you have to get that checked up and see what is your range for the glaucoma, for the risk that you might have. But that any doctor that you meet, if you tell them that you underwent LASIK, they will immediately check and see what your range should be.
Doctor, we've got so many questions coming in, but we have a couple of announcements also coming in, so please stay on. One last question is about exercises for glaucoma, and just to keep oneself fit. There are so many webinars, and the screen time has increased considerably. There's somebody who says that my son, who is 25 years old, is always on the screen at home studying or watching films. What are some general advice for our readers here for taking care of their eyes?
So, Pradyuman, as I told you the last time itself, we had this conversation in great detail about fooling nature. Now, what happens is that I'll just repeat it fast so that, since they want to know, we've been farming for about 10,000 years. We've been hunting for 2 million years. And the eyes have always been meant when you're outdoors, doing all that stuff. We never had phone, iPad, Kindle, laptop, PC, even when we were young. And therefore, the eyes were never meant for near work. So you're meant to be outdoors the whole day, or at least doing a little bit of far and near and having breaks. Now, what happens with these kids is that they only end up doing near work. So these days, after the age of 18 years also, I've been noticing that 40% of people have changing numbers even after 18, which in our time never happened unless you did some CA law, MBBS for 2 years, some very heavy exam, then your number changed. These people's whole life is now become one big CA exam or one big law or MBBS exam. They have no idea how to look far only. Now all the entertainment also has come close. Netflix, Snapchat, Insta, Twitter, YouTube, everything is now close. So the problem is that they are doing excessive amounts of near work, and nature is trying to help them with their new occupation, thinking they don't need to farm and hunt anymore. They are only into near work. So the moment, if you don't have a number also, nature slowly will try and bring your focus to the computer. So you end up with a minus 0.75, -1 number. Now, the moment you wear because then you can't see far, so you wear a minus 0.75, -1 and start looking far again. Nature doesn't know you as specs. So nature effectively thinks that you don't have a power because you can see far really well. Now with that fast specs, you again start doing near work. Again, nature starts bringing the focus of that -1 number from far to close. Again, you say can't see far, you make that number -175, -2 again. Again, you take it far and make it clear. Again, nature brings it down. So from the age of 8 to 36 years, anyone who enters my place and who sits on my examination chair is sent out becoming a farmer. Everyone learns how to do near work, because you can't stop this whole new breed from doing their near work, whether it's iPad, phone, Kindle, laptop, PC, books, whatever it may be, they will just not stop. So there's no way you can stop anyone from doing near work. All you have to do is fool nature into thinking that that child of 25 years is into farming, so that they are safe that way. I, of course, also teach them how to look after neck and back, because now these days the average age at which someone goes to the physiotherapist from the 60s has gone now down to the 20s, because again, even the body is meant actually to chase animals. And instead of chasing animals, you freeze for 2 to 3 hours at a time. The neck and back goes at a young age. What should happen at 80 happens now at 18 often. So that's the other point I want to make, that they have to be very careful about taking breaks. But there is no answer to how to stop these kids from doing near work. Their near work is only going to get worse. So what I do is with a different part for near work, I teach them how to fool nature. So everyone goes out of my room becoming a farmer. So at least the number doesn't change. Then I try my best to help them with neck and back also, but at least the number should not change.
Thank you very much once again. And
Thank you. I'm always happy to be of help. You all have been really wonderful with the seniors and with me. Thank you very much.
And to all
hope to see you soon.
Happy Diwali in advance, and see you on November 21st. Thank you.
Great. Take care. Bye.